Let's see here. No fraud, right? Let's see what words we get here. When we think about program integrity, and not just in CCDF, but across all programs, right? But especially in CCDF, since this is related to CCDF. We have accountability, good stewardship, you got a lot of people moving around. Just click right inside that cloud if you use the T here. And you'll just click in your term that you'd like to use for today's word cloud. Compliance. And I think I know where you're going. I think this is someone's going to put in financial accountability, which I thought was good. They took it out. Appropriate fund use. Transparency. Megan Roberts in the chat box said responsibility. Looks like the word of the day is going to be accountability. Honesty. All right. So we're going to stop the word cloud in just 1 minute here so that we can talk about program integrity in CCDF and also some program integrity requirements and strategies. So we'll give you guys about 1 more minute here. It's like the word cloud has disappeared. So we're going to go ahead and close down this whiteboard. 1 moment. All right. Thank you guys for your participation. And now let's go back to our presentation here. So when thinking about program integrity, it's good to have a fundamental understanding of what program integrity is for your agency and what that looks like. If you go across government agency websites, you'll find that program integrity, by definition, looks different across those agencies, but the underlying concept of program integrity remains the same. So for example, on your screen, we use just a simple definition from the Merriam-Webster dictionary combining 2 words, right? Program and integrity. Program, a plan or system on which an action must be taken towards a goal. In our case, it's going to be the goal of the regulations within CCDF. And then affirm adherence to the code, especially moral or artistic values, right? So we're going to talk a bit about ethics in the acronym in just a second, but about doing in general, when we think about integrity, it's just about doing what's right, even when no one's looking. But when we combine program integrity, we have the system or processes put in place to ensure a firm adherence to the regulatory requirements of the CCDF program. So again, this is an example of what a program integrity definition could look like. But it is important, I think the concept here for everyone to take away is that it's important to have that fundamental concept or foundation for an agency to build off of. And that way you can have buy-in from your staff and support from your stakeholders, right? So let's look at the word ethics, because we talked about incorruptibility, right? So we have this acronym of ethics in which we broke out for you guys, right? So why is it important, program integrity important in CCDF? Well, it's important because we ensure that the program and provider are quality, that those taxpayer dollars are spent appropriately, as someone stated, or we had 2 individuals state within our word cloud. We help families to sustain employment and education to become self-sufficient, incorporating internal controls to prevent fraud, waste, and abuse, and conserve the finances, the public finances, financial accountability. And through that, we're safeguarding funds to maximize benefits for eligible children and families. So let's talk about some of the program integrity benefits, right? Let's continue with this. So if we look back at that ethics, the benefits also include we have correct eligibility determination because of those internal controls and that buy-in we have from staff on understanding what program integrity means within our organization. Eligible children and families receive CCDF benefits. We know that providers will meet federal and state CCDF participation requirements. We know that our payments are timely and accurate as it relates to those child care payments. We reduce improper payments, and we have the necessary internal controls and strategies to deter fraud, waste, and abuse. So now let's talk about some of the requirements and a few strategies agencies can consider as it relates to these CCDF federal requirements. So at 45 CFR 9868, the program integrity regulations require lead agencies to describe in their plan effective internal controls that are in place to ensure integrity and accountability while maintaining continuity of services. And these include sound fiscal management, identify areas of risk, train providers and staff about program requirements and integrity, and a regular evaluation of internal control activities. So now we'll talk about a few strategies related to each of these requirements before I transfer it over to my friend and colleague Mike to talk to you guys about 9868B. So beginning with sound fiscal management, some strategies an agency could consider implementing is the monitoring of contractors as well as subrecipients to ensure compliance with CCDF rules, conducting annual audits, internal audits to ensure proper fiscal controls, and routinely reviewing payments to make sure costs are reasonable and allowable. And next, we have risk identification strategies. So some things an agency can consider here are developing guidelines to monitor program performances against the mission objectives and the subsidy-related goals, reviewing job duties and staffing structure to ensure proper oversight, utilizing the internal controls, the grantee internal controls self-assessment instrument, and conducting analysis of errors and improper payments utilizing a risk analysis tool. Now, with this risk analysis tool, it does not need to be sophisticated or anything of that nature. You can conduct an analysis using something as simple as an Excel document. And next, we have trained providers and staff on the requirements, right? So this could include training manuals, trainings on policy manuals and policy changes, either online or through webinars, providing staff and providers with forums to discuss program requirements and changes, on ongoing monitoring and assessment of policy implementation, and as I stated, making content online. And my favorite here, which is a regular evaluation of internal controls. So some internal control strategies, and a lot of agencies have already implemented some of these, which include red flag reports or real-time system alerts, reviewing established protocols and procedures to ensure consistency and accountability, and then a regular assessment of administrative errors and improper payments. All right, so we will conduct a short poll right here. And from your state plan, what is the most effective internal control that you use? So you should see a poll coming on your screen here shortly. And if you guys could just answer that, that would be great. And we will share the results of that poll. And we'll give you about a minute or so to answer the report. Not the report, sorry, the poll. And let's see which particular internal control is very popular, if you would, amongst states right now. We'll give it a few more seconds here. Like we've got about 30% participation on the poll. And if you have a strategy that's not listed, but you feel is very effective, feel free to type it in the chat box. And if either attendee would like to come off of mute and talk a little bit about their particular internal control with the group, feel free to raise your hand and we will take you off mute or come off mute and we'll be happy to hear from you. It's like we have about 40% participation on the poll. So we'll be closing it down in just a second here. Let's see if anyone has entered anything into the chat. Nope. Would anyone like to come off mute and share their internal control process that they've included in their state plan that they feel is very effective? All right. So we will end the poll here and I will share with you guys the results. And it looks like QA and supervisory reviews won by a very small margin. However, it still won. So it seems like a lot of you, it appears that a lot of you guys feel that the reviews are the most effective internal control process implemented. All right. So with that, I will turn it over to my colleague, Mr. Mike McKenzie. Mike?
All right, thank you, Janae. Interesting poll results. Glad to see that QA and supervisory reviews rank right up there. I think that's a really valuable tool. So now we want to turn the discussion to fraud investigation and improper payments. And this, as Janae stated, excuse me, a little earlier, this is also in 98.68, but this is in sub B. And this one really focuses on identifying fraud or other program violations, and also recovering fraudulent improper payments. Keep in mind that the regulations require agencies to recover fraudulent improper payments, and you have the option as to whether or not you want to recover other benefits or not. Next slide, please, Janae. We have identified some strategies here for you to utilize to identify fraud in your CCDF program. This is not an exhaustive list, but just to give you an idea of what we've got. So clearly defining fraud or intentional program violations can go a long way, especially in hearings. If you have to go to an administrative hearing or a court hearing, if you don't have a clearly defined policy, you could run into roadblocks on that. Clearly, we saw the review of attendance and billing records is a common tool that agencies use to identify fraud, as well as the quality control and quality assurance reviews. That can be done by a quality control unit. It can be done by a supervisor. But I think that's a very effective tool for identifying fraud in your program. Data analytics is great because I think it always allows you to put stuff into the system that can hopefully eliminate some of that human error that occurs if you don't have it built right into the system. Red flag reports, Janae made mention of that. Again, very useful tool that you can use and update within your own system and tailor it to how your system operates and what type of errors or cues you are looking for. And then finally, the fraud toolkit, which is a tool that was created between our center and the Office of Child Care. And it can help you to identify what areas you're doing well in, as well as areas that you might want to put some more focus on. All right, next page, please, Janae. Some other strategies for investigating fraud. We talked about provider billing and case reviews already. Another useful tool is to collaborate with other programs. So keep in mind that if you have an agency that separately determines SNAP eligibility or Medicaid eligibility, WIC, LIHEAP, all of those can help you out if you work together. And rather than simply having all of those agencies request information for an investigation, maybe you can share that information. Fraud desk guides are another useful tool that you can use within your own agency. Fraud awareness is the whole idea of educating our clients, educating providers, and educating John Q. Public, letting them know that we are taking care of the funds that are used to administer this program, and where to call if you know of fraud that is occurring. Many agencies have a fraud hotline, and this is a great way to get information from the public on what's going on. On-site visits are becoming more prevalent now that the pandemic has subsided. And so on-site visits of providers is a good strategy for investigating fraud if you have the staff, as well as surveillance. And the cool thing about surveillance is that you can do it with your staff, or you can contract with an agency to perhaps do that surveillance for you after hours. All right, let's move on to the next slide, please, Janae. A little more on improper payments recovery. And I talked about this before, but I just want to reiterate that while you are required to recover payments resulting from fraud that were improperly distributed, you do have discretion regarding recovery of other improper payments, such as unintentional program violations, or just client error, not necessarily fraud, but just client error or agency error. So it's up to you. Technical assistance is available. If you have questions about that, just reach out to your regional office, please. As we put on this slide, there are various strategies to recover fraudulent payments from providers and participants, including repayment agreements, our IRS tax offset, and actually the tax offset is available generally at the state level, not at the federal level for CCDF. A reduction in future benefits is also an option. And in some cases, we have heard of some agencies that actually use a lien and levy action to enforce recovery of improper payments. All right, so we're going to take a little break here and talk about this a little bit. And again, you can put this in the chat. Oh, we have a poll here. Thank you, Janae. So we're curious, what eligibility processes do you have in place to determine or prevent fraud? And again, if you want to come off the phone or come off mute and share that with us, we would love to hear from you. Otherwise, the poll here is asking you what collection strategies your agency uses: repayment, tax intercept, benefit reduction. If you use more than one, feel free to make more than one entry here. Clearly, right now, repayment is the strategy used by most agencies by a long shot here. And again, what IP collection strategies does your agency use? Does anybody want to share anything with us in the chat, or come off mute and share their strategy with us? We're going to give you another minute to see if we get any more responses, or see if anybody wants to share other ideas that they have. Certainly, in terms of eligibility process, one of the things that we hear from agencies is having an error-prone profile. And the idea here is that an error-prone profile can be utilized either built into your system, or it doesn't have to be high tech. It can just be something that your agency uses. As an example, one of the agencies that we're aware of has an error-prone profile that identifies anyone that comes in and applies for CCDF and suggests that they came from another state. As part of the error-prone profile, that agency will reach out to the state that that person came from to make sure that their case is closed. Again, this doesn't necessarily mean fraud has occurred, but it's possible that the person left another state and forgot to inform the agency that they were moving and didn't have their case closed. We don't want to have benefits continue to be generated if the person isn't there. All right, so I think we've given the poll enough time. Clearly, repayment agreements are the top vote getter, and tied for second place, tax intercept and benefit reduction. So thank you for participating in the poll here. Next slide, please, Janae. All right, we're going to shift gears here a little bit, and we're going to talk about the results from your program integrity activities. Everybody has results, and within section 8 of the current CCDF plan, 3 of the subsections specifically ask agencies to include a description of the results of their program integrity activities. And believe it or not, the next state plan that will need to be submitted is right around the corner, folks. And you can expect more of the same in the next state plan. And we received quite a few questions through the regional offices about results. And so that's why we wanted to highlight this and just talk about it a little bit and provide you a few examples. So we'll start out with 8.1.5. And again, in the next state plan, these numbers could be totally different. So we'll refer to the current state plan, and 8.1.5 has to do with activities that you currently conduct to investigate or prevent fraud and abuse of the CCDF program. Red flag reports are a great way to identify within the system whether or not you have something to analyze. And we've just given you a few examples here, but each time you have a hit from one of these red flag reports, that's a great way to keep track of the results from your program integrity activities. So each report measures results and will indicate if an investigation is needed. Again, we're not saying that this is necessarily fraud, but this is an indicator that something's not right and you might want to check it out. Now, when we talk about results, when I have seen submittals from state plans, there's 2 types of results that I've seen. One is qualitative, that talks about things like, as a result of our program integrity efforts, we plan to offer training in the future on this particular topic. The other type of results that I tend to see are like the one you see on the screen right now, which is more quantitative. And I think this is a really good example, so we just wanted to share it with you. And in this case, the lead agency indicated that as a result of their investigations, that they established a total of over $440,000 in provider overpayments for intentional program violations, and just over $300,000 in claims were established for client intentional program violations. Everybody has this kind of data. It may not be in the agency that you are currently being administered by, but that's why it's so important to find out who has this information and see if you need some type of a written agreement in order to obtain that information on a timely basis so that you can review it and look at it prior to submitting to OCC with your results. One more good example that we wanted to share, and this one has to do with case reviews. And you can see here that the agency indicated that they reviewed a number of files. 868 client files were audited for eligibility errors, resulting in 52 cases of improper payments found and corrected, which is great. Great information. These are the type of results that OCC is looking for when you submit your state plan in terms of the results from your program integrity activities. Very good example. Just a few more examples of PI results for you to think about. Claims established, we talk about that a little bit already. Not only the type of claims that you established, but how did you collect? And it depends again on your agency. As we stated before, you're required to recover fraudulent payments, but agencies have the option as to whether they collect other improper payments. So you can, as an example, so for your results in your state plan, you can lay it out in terms of not only what type of improper payment you collected, but how you collected it. Was it through tax intercept and how much? Was it through repayment agreements and how much? Those are the type of things that OCC is looking for when you provide your results. Improper payments recovered, we just talked about that a little bit. And intentional program violations. If you can give a count of the IPVs that you referred and then those established after adjudication, that's very helpful information for the Office of Child Care in terms of what is working and if there are any policy changes that need to be made. Even if your count is 0, you're still tracking the results, and I would encourage you to report that. All right, next slide, please, Janae. So now we're going to have a little bit of a discussion about this one. We're curious about whether there are any agencies out there that track something we have not described. If so, why do you track that data? And do you have stakeholders that are interested in this information? So again, you can go into the chat and give us an idea. You can come off mute and share it with the group if you want. We're going to give folks a couple minutes to provide any answers to these questions. When you're tracking this kind of data, it's great if you can track it in the system, but we have seen many agencies also track it in Excel spreadsheets. It doesn't have to be fancy. The main thing is to track your results in some way or another. Anybody have anything they want to share? I've seen a lot of state plans in the last couple of years, folks, and you guys are doing a great job with this. So I know that information is out there. Alicia Wells provided some information. She says, we track in Excel, which is great based on the type of error, whether it's income calculations, residency, etc., so we can determine the training needs. Thank you, Alicia. Great example of what I'm talking about. And glad to see you're using Excel. It doesn't have to be fancy. All right, Janae, let's go to the next slide, please. I'm going to turn it over to our counterparts from the Office of Child Care now, Adi Fatur, to talk about the CCDF national error rate. Adi?
Yes, thank you, Mike. So like Mike said, now we're going to shift and talk briefly about the CCDF national error rate. So as you all know, the implementation of the error rate review is a key part of state's program integrity work. In a few minutes, Katie Watts will talk about the state reporting in a little more detail, but first we wanted to share some broader context about why the Office of Child Care collects this information, how we use it, and what results and trends we are seeing. So next slide. Great. Okay, so here is a high-level overview of why the Office of Child Care is required to collect this information and how we do it through the error rate review as outlined in the CCDF regulations. So first, the Program Integrity Information Act of 2019, or PIA, as we often refer to it, is the broader law governing executive branch agencies for improper payments. So PIA requires federal agencies to review programs and activities, identify those that may be susceptible to significant improper payments, publish improper payment estimates for those programs, and implement corrective actions to reduce improper payments. So what this means is that because CCDF is considered a program susceptible to significant improper payments, the Office of Child Care is required to calculate and publish an annual CCDF national error rate. And we'll show you how we do that in just a minute. And just a quick note about what you see on the slide. You might notice this law is recent. I just want to point out there have been several iterations in law going back to the Improper Payments Information Act of 2002. So while there have been minor changes over the years, the core expectations around reporting improper payments are not new. So if you've been doing this work a while, this will seem very familiar. And then at the bottom of the slide, you see the CCDF regulations, which outline the Office of Child Care's expectations for how states implement the error rate review. So please visit Subpart K where you can see all the details, but just a couple of key pieces we wanted to note here. All states, District of Columbia, and Puerto Rico are required to submit the state improper payments report every 3 years, and any state with an improper payment rate that exceeds the 10% threshold must submit a corrective action plan to OCC. So we can go to the next slide. All right, so we just wanted to briefly also explain what we mean by improper payments in the context of CCDF. So for the error rate review, we're looking at eligibility determinations and subsidy authorizations and payments. So here, improper payments really means any payment that was made to an ineligible recipient, payments made for ineligible services. It can also be a payment made in an incorrect amount to an eligible recipient. And it also includes what we refer to as unknown payments, which really mean that the lead agency doesn't have enough documentation to show whether the recipient was eligible. So we really ultimately don't know whether there was an improper payment. So for CCDF, we measure this using a case record review process, which Katie will talk a little bit more about. So lead agencies review a sample of case records. They determine whether any eligibility errors were made, and if so, whether those errors resulted in improper payments. And of course, as you all know, states have varying requirements for establishing and verifying eligibility. So in addition to federal rules, lead agencies also look at state and local requirements when they're determining whether eligibility was done correctly. So of course, this methodology does allow states to determine the error types and their sources to make sure they can reflect the policies and procedures unique to their state. Okay, next slide, please. Thank you. All right, so here is a high-level overview of how we calculate the national error rate. States are broken into 3 cohorts, and they submit the State Improper Payments Report every 3 years to report their error rate and other improper payments findings. So OCC uses the information collected from these reports to calculate the CCDF national error rate. So we do this by combining the data from the current cohort with the data from the prior 2 cohorts. So basically every year we publish an error rate that has 1/3 of states' new data and the prior 2 years of data. We are required to report the national error rate annually in the Department of Health and Human Services Agency Financial Report, or AFR. And I believe in a couple slides, we have a link to that report if you're interested in seeing more detail. Next slide, please. Great. So before I show you the 2022 findings, here are the cohorts and reporting periods included in those calculations for 2022. So of course, if you do this work, you know that the error rate's a look back. So that means if you submitted the report in June of 2022, you're reporting on cases from 2021. And it's not on this slide, but if you are a cohort 1 state and wondering about these dates, we know that you just submitted your 2023 reports this past June. We're currently reviewing and analyzing that data, and we'll use it to update the CCDF national error rate for 2023. And we expect that to be published this coming November. So stay tuned if you're interested. We can share more about that. All right, so next slide. Perfect. So this is, whoops, I lost my place. So this is the most recent CCDF national improper payments error rate for fiscal year 2022. So you can see it's 3.96. That is a decrease from the prior year's rate of 4.36. And we also had a decrease in the estimated improper payment dollars from the prior year. So, and of course, it's important to note with those dollars, those are estimates. So the majority of improper payments, or about 2/3 in this cycle, they were due to missing or insufficient documentation. The most common types of missing information in case files in that cycle related to income, applications, and parent and work activity schedules. And a smaller number, about 1/3 of the improper payments in that cycle, were due to what we refer to as administrative errors, with the most common types being errors calculating income, copay, or need for care. So this information was published in the HHS 2022 AFR last November. There's a link on the bottom of the slide if you want to see any more details about the findings or any of our mitigation strategies, and we can pop that link into the chat a little bit later on. Okay, next slide. All right, so finally, we just wanted to end with a look at the CCDF error rate over time. So OCC began implementation of the error rate review methodology with states in 2007, with the first reports in 2008. So of course you can see here that the national error rate really has declined over time. And we really do attribute that to the ongoing efforts of states to improve their program integrity and accountability. So some of the state strategies that states have reported to us over the years, each year in their 404s, include things like implementing new or enhanced IT systems, new automation in their eligibility systems, providing increased training and technical assistance to eligibility and field staff, updating or streamlining their policies and procedures for eligibility, conducting ongoing monitoring and case reviews, participating in TA and training. So a lot of the things that Mike and Janae have been talking about today. At the federal level, the Office of Child Care has also increased our support and oversight. So a few of the things we do provide targeted technical assistance and training to states on the error rate methodology, on program integrity and accountability, and a variety of other topics. And we also provide oversight of the error rate methodology through our joint case review process. So that is one way that we can ensure consistent implementation of the error rate reviews. And it's a good opportunity to help states troubleshoot some of those issues in their own review process. And finally, of course, we work with states that have an improper payment rate above 10% to help them submit and implement corrective actions to identify and address the root causes of those errors. So really, we just, of course, want to reiterate that we thank lead agencies on this call for all of your continued efforts to implement the error rate review, to reduce improper payments in your program. We do look forward to continuing to partner on these efforts. Stay tuned for more information about upcoming error rate cohort webinars and other information as you get closer to your own reporting deadlines. So unless there's any questions, I will turn it to Katie Watts to share some additional information about error rate reporting.
All right. Thank you, Adi, for the overview of the national error rate. And now I would like to speak a bit as to what all of this means for states. So what are states' responsibilities with regard to the error rate review? Next slide, please. Thank you. So AD did touch on this already, but in the error rate review, states review a sample of case records from their CCDF program to determine whether any errors in eligibility determination occurred, and if so, whether those errors resulted in improper payment. There's 3 cohorts of states, and each cohort completes the review once every 3 years. During the review process, the state reviews a sample of 276 case records from a 12-month period. And after completing the review, the state reports on the findings, including what were the error causes and what are plans to reduce the errors. Next slide. So AD did mention the regulatory requirements governing the error rate review, which can be found in subpart K of 45 CFR 98-100, which is titled Error Rate Reporting. And this, of course, does provide some helpful information on the review and what states must do to complete the process. However, the most complete source of information for states is the data collection instructions, which we also refer to a lot as the DCI. The DCI was written by the Office of Child Care, and it's updated approximately once every 3 years. And in those updates, we incorporate any changes to the methodology and also provide clarifications or additional instructions. The DCI, or data collection instructions, consists of several parts. There are in-depth instructions on how to complete each of the required error rate submissions. There's some step-by-step guides for completing the case sampling and for conducting reviews. And there's also templates for each of the required submissions. The DCI can be found at the Office of Child Care's website, or you can also always reach out to us and we can send it to you. Next slide, please. Thank you. So this slide breaks down the steps to completing the error rate review process. The first step, starting from the left-hand side, is to learn about the process by reading that DCI. We also offer cohort training webinars to learn about the error rate review. If you are part of the year 3 cohort, for example, there will be a webinar sometime in the coming months. Don't have the date settled on yet. NCSIA also offers more individualized trainings for states, like one-on-one trainings if there's a new staff or you just don't feel like, waiting for the next webinar. We can offer one-on-one trainings to the states. Once you have a good handle on the process, we'll move to the second step, which is to plan for your reviews by completing the sampling decisions, assurances, and fieldwork preparation plan. This is the first of the required submissions, and it includes your plans for sampling, for staffing, for project responsibilities, and your plans for conducting reviews. Next step is customizing the record review worksheet, and this is the tool that states use to conduct their reviews. Parts of the record review worksheet are in the form of a template, and parts of it are customized to conform to your state's policies and procedures. Like the sampling decisions, assurances, and fieldwork preparation plan, the customized record review worksheet must be submitted to the Office of Child Care and approved. And once those have both been approved, then you are free to go ahead and conduct your 276 case reviews. The next step, second to last step, is to report on your findings. And this is done using the State Improper Payments Report, where states share the results of their reviews, what were the causes of errors, and what are the plans to correct those error causes. And finally, if the state's percentage of improper payments exceeds 10%, then the state must create and implement a corrective action plan. Next slide. Thank you. On the State Improper Payments Report, which again is that final report that contains the results of the case reviews, the state shares their plans to reduce errors and also they also share what action steps they took to reduce the errors that were identified during the previous cycle and the outcome of those action steps. We ask whether the action steps led to a decrease in those errors that were identified in the last cycle, and overwhelmingly states share that yes, the action steps did decrease the errors. So the error rate review process isn't just looking at cases and telling us what you found. It promotes and drives program integrity through identifying and implementing direct action steps to reduce eligibility errors. Next slide. Okay, so here we have another let's talk about it with a few questions about the error rate review. If you want to take yourself off mute and speak up, or you can write something in the chat or Q&A box, or you can just think about these on your own. You don't necessarily have to speak up. But a few things to get you thinking. What is your role in the improper payments process? How do you use the results from your error rate review? And have you implemented new strategies as a result of your most recent error rate review? So I'll give you a moment to think about that. All right, at this time, I'm going to hand it back over to Mike. Oh, actually, before I do that, we did get one chat in from Christina Creighton. So the error rate results were used to improve training for eligibility workers and to drive internal QA review of processes. Yeah, I think that you know, in the state improper payments report, we see that a lot. Trainings for eligibility workers really being updated or changed based on error rate results. So kind of customized to really zero in on those areas that were identified in the review. Thanks, Christina. All right, Mike.
Okay, thank you, Katie. Some really good information for folks to have. And I just want to reiterate what Katie said, in that don't just make this an exercise in reporting. Use the information that you glean from your error rate review process to improve your program. And clearly that has happened. When you looked at those numbers that AD shared with us, going back to 2007 to where we are now, we have seen a regular decline in terms of the overall error rate, which means we're taking better care of the funds that are allocated to us. So again, all the credit goes to the agencies that conduct the error rate reviews and use the information to improve their program. So thank you for that. We are going to wrap things up pretty quickly here. Wanted to make you aware of some program integrity resources that can help you to improve your program. So let's go to the next slide, please, Janae. Nixia has a program integrity resources landing page, and we have provided the link here to you. We will make sure that all participants have a copy of today's webinar so that you can access these links yourselves. The landing page includes information on the fraud toolkit, which we talked about a little earlier, as well as the grantee internal control self-assessment instrument. And I want to make the case for both of these in that these are tools that you can use to assess your program at your own speed. How are you doing? Are you doing well in terms of program integrity overall, or are there some things that you might want to work to improve on? There are 5 sections in both the fraud toolkit and the self-assessment instrument. You can go to the links for those. If you want technical assistance, reach out to your regional office, and that help is on its way. Program integrity webinars. Every one of these program integrity webinars that we provide and present, we keep the transcript and the slide deck, and we put it on our landing page so you can go back and review that if you want. We've had a lot of different agencies participate and share some of their best practices. So I would encourage you to go and look at that. There's always lots of information related to fiscal aspects of CCDF. So we have a fiscal fundamentals training that's available, as well as a brief that you can look at to give you additional information. Any type of regional presentations that we do, we provide the links to that as well. There's a succession planning checklist or contact list that you can use. One of the reasons we offered this presentation today is because there has been quite a bit of turnover in the last few years. The last time we presented this information was late in 2019. So with that turnover, the succession planning contact list or checklist can help you out. We do provide information for tribes as well. This particular presentation was more focused for state agencies, but we do provide a lot of information for tribal lead agencies as well, and they have a risk assessment tool that they can utilize. And we have provided just recently, actually, a specific tribal lead agency program integrity webinar, and we plan to do more of that in the future. All right, next page, Janae. Following up on what Katie had talked about before, a lot of good resources for you to conduct a successful error rate review process as well. As Katie mentioned, the data collection instructions are on this page, and everything you need to know about the error rate process is in there. How to complete your STAP, how to customize your record review worksheet. There's a lot of good information in there. All the training and technical assistance cohort calls that Katie referred to, the links are on there, so you can go back and look at that for your own edification if you want. Error rate information is on there, fact sheets related to the error rate as well. And again, we're always there to help you out. So if you have any questions or concerns about completing the error rate review process, please reach out to your regional office. They're a great resource, and they can connect you with the right people. All right. So that concludes the details of what we wanted to provide you today. It went a little faster than we expected, but we've got plenty of time left. We've got up to half an hour. If anyone has any questions for either your peers or anybody that's presenting today, we're just going to open it up and see if anybody has any questions or anything they want to share with the group right now. Anybody have any questions for their peers? Got lots of good participants on this call today. It's an opportunity to check with your cohorts to see if you have any questions, if there's anything they can help you out with. All right, any final questions or comments from either anybody that's participating or any of our presenters today? The topics for these webinars come from you. So if you have any future topics that you would like us to cover, please share your ideas. When we wrap up today's webinar, an evaluation form will come up, and I'm asking you to please take just a couple minutes and complete that evaluation form. Your feedback is important to us so that we give you the information that you want with these future program integrity webinars. And with that, I want to thank you all for participating today. Thank you to the Office of Child Care for providing us the information on the error rate. Thank you to my coworkers, and hope you all have a great day, and we'll see you next time around. Thank you.
Thank you.